Gil, in addition to having a horse vetted, we often hear people, perhaps who are doing a bit more with their horse, talking about purchase x-rays.
Yes.
Who might have those done and what would it include?
Well, the purchase x-rays are generally for horses of greater value. And it's an added assurance for the purchaser that there is nothing that the eye can't see that it may potentially be going on in the joints that could give rise to problems in the future. So there are various packages of x-rays that we may have, and the insurance company may request a different package depending on the value for which the purchaser wishes to cover the horse. So initially, we all know that the most common lamenesses are in the feet, of course. So the most basic package would be a set of x-rays of the feet. That's very informative for the farrier. But of course, we can also look at the navicular bones. We can look for any osteoarthritis in the joints of the feet that may potentially cause problems in the near future or during the ownership of the horse. We can go on from there. We can x-ray the fetlocks, which are particularly something that show jumpers like to x-ray, because fetlock problems are quite common in show jumpers, particularly the front fetlocks, because of the sheer amount of weight coming down from a height. So not just weight, but the momentum of the horse as well. So fetlocks are very often x-rayed. Also knees. The carpus, or the knee, is the only joint in the horse which is maximally weight bearing at its maximum point of extension. And what I mean by that is that every other joint will be mid-range when it's asked to take the most weight. The knees are at their full point of extension when the horse is carrying most weight. And as a result of that, in the show jumper in particular, we're most prone to develop osteoarthritis on the front surface of the joint, because the joint is being asked to extend a little further than it is actually supposed to. So we can see osteoarthritis there. Then we go on to the hind limbs, of course, and the hind limb x-rays, x-rays of the hocks, x-rays of the stifles, very, very common amongst those people who intend to have a high-level dressage career with their horse. They want to know that there's no possibility of early osteoarthritis of the distal hock joints, classically known as spavin, developing in their horse, because that will lead to hind limb lameness, which in a dressage horse is a massive problem, because of course with the collection of the horse, we're actually asking for more weight to be carried on the hind limbs than a horse would ordinarily carry in its normal day-to-day life. Stifles, many stifle injuries can be related to a condition called OCD, osteochondritis dissecans, which is a developmental bone disease, also affecting the hocks as well, I should have mentioned. Those are two common areas where we develop OCD, and that OCD requires surgery to resolve, which may not always be successful, often is successful, but may not always be successful. And we can check for the presence of OCD at the vetting with the x-rays. So many owners will choose, particularly of a dressage discipline, but will choose to have the hocks and stifles x-rayed as well. And then we can have the back x-rayed. We all know the condition, or all heard of the condition, kissing spine, and that can lead to real resentment at ridden exercise. Classically, the horse moves very well in hand, on the lunge, on a lead rein, but when asked to trot or canter under saddle with the weight of the tack and the rider on top, really resents it. And that is how classically we would detect kissing spine. We would look to x-ray the back, and we can see that the spines of the vertebra are very closely aligned, so that they're actually squeezing the soft tissue between them and potentially even rubbing against each other. And kissing spine is something that we can get a good handle on at initial pre-purchase x-rays. So yeah, you can go from having a minimal package of both front feet, which would tend to be 5 x-rays of each, looking at the navicular bone, and an x-ray of each hind foot, which is just 12 x-rays, right through to, I think, about 56 x-rays, which are all 4 feet, all 4 fetlocks, both knees, both hocks, stifles, and along the back.
And would somebody normally have these x-rays done following a vetting, like at the same time in the same call out?
You wouldn't want to go through the expense of potentially 56 x-rays if the horse is lame. We may have found a melanoma or a sarcoid, or with oral skin plaques, or with an overbite in the mouth. We will have a discussion with the owner at that point, and they may say, no, I'm not going to buy the horse, in which case, why put the purchaser through the expensive x-rays? Why put the current owner, the vendor, through the hassle of having their horse likely sedated and an hour spent doing x-rays when there's no sale in the offing?